The following video will demonstrate our technique for diagnostic and therapeutic shoulder arthroscopy with small bore needle arthroscopy. These are our disclosures. The associated equipment, including the Arthrex nanoscope, is indicated here. Insufflation of the glenohumeral joint is performed first in order to prevent iatrogenic damage. As with standard arthroscopy, we begin from the posterior portal. The trocar is introduced and directed just medial to the coracoid. The stopcock is assembled. The camera is calibrated and inflow tubing is attached. Once the camera is inserted, the resulting view is as seen here. Then the anterior portal is established using the sharp trocar from the anterior portal, just lateral to the coracoid. It's introduced and will serve as an outflow portal and can be utilized as a probe. The sheath is seen here, as is the associated anatomy of the biceps and the labrum. The anterior sheath can also be used to elevate the rotator cuff, revealing the insertion of the supraspinatus tendon. Anterior glenohumeral arthroscopy is then performed by moving the camera to the anterior portal and establishing a view of the posterior structures. Here the posterior labrum is identified with the humeral head to the right. By adjusting the arm position and bringing it into slight internal rotation, an excellent view of the articular cartilage can be achieved. Attention is then turned to the subacromial arthroscopy. The camera is removed from the anterior portal, redirected into the subacromial space through the posterior sheath. The anterior sheath is also moved into the subacromial space and can be visualized here. Again, the anterior sheath may be used as a probe to evaluate the insertion of the rotator cuff and the bursal side of the tissue. Portals are closed with a dermabond glue and allowed to dry. Thank you.